आदरणीय दर्शकबिन नमस्कार। अहिले तपाईँ हेर्दै हुनुहुन्छ कार्यक्रम खुला विचार। यो कार्यक्रम हरेक मङ्गलबार बेलुका 11 बजे र बुधबार बिहान 8:30 बजे म्यानचेस्टर पब्लिक टिभी च्यानल 23 मार्फत प्रसारण हुन्छ। यसको अलावा यहाँहरूले हामीलाई सामाजिक सञ्जाल जस्तै फेसबुक, ट्विटर र युट्युबमा गएर पनि तपाईँले खुला विचार लेख्नुभयो भने प्रत्येक एपिसोड तपाईँले चाहेको समयमा अवलोकन गर्न सक्नुहुन्छ। तपाईले www.manchesterpublictvchannel23.org मार्फत पनि हाम्रो कार्यक्रम खुला विचारलाई अवलोकन गर्न सक्नुहुन्छ। आज भने म तपाईहरुको प्रस्तुता सीएम निर्ला मेरो टेक्निशियन डेभिडको साथमा उपस्थित भइसकेको छु र मसँग आज अलि भिन्न प्रकृतिका अतिथि हुनुहुन्छ। उहाँको नाम डाक्टर ग्याभिन म्युर, चिफ मेडिकल अफिसर एट म्यानचेस्टर कम्युनिटी हेल्थ सेन्टर। मैले उहाँलाई धेरै परिचय दिइरहनु पर्दैन। म्यानचेस्टरमा बस्ने अथवा न्यू ह्याम्पसायर बस्ने अधिकांश हाम्रो मानिसहरूले उहाँलाई चिन्नुहुन्छ। आजका मेरा अतिथिसँग स्वास्थ्यसँग सम्बन्धित छलफल गर्नेछु म। यदि तपाईहरुलाई कुनै जिज्ञासा प्रश्नहरू भएमा तपाईहरुले हाम्रो कार्यक्रम मार्फत जिज्ञासा प्रश्नहरू राख्न सक्नुहुन्छ र तपाईले चाहेको समयमा हाम्रो कार्यक्रमलाई अवलोकन गर्न सक्नुहुन्छ। आजको हाम्रो कार्यक्रम अंग्रेजी भाषामा हुने भएकाले यहाँहरुप्रति हुन गएको असरलाई हामी क्षमा प्रार्थी छौं। आज भने मेरा अतिथि डाक्टर ग्याभिन जे म्युर अंग्रेजी भाषी भएको अर्थमा हामीले यसलाई अनुवाद नगरिकन जस्ताको तस्तै प्रसारण गर्ने निर्णय गरेका छौं र उहाँकै आवाजमा उहाँका शब्दहरू सुन्ने हामीले निर्णय गरेका हुँदाखेरि हामी यसलाई ट्रान्सलेट नगरिकन जस्ताको तस्तै हामी प्रसारण गर्नेछौं। Welcome to the show, Dr. Muir.
Thank you very much.
I would like to start by asking, can you please tell about yourself and about Manchester Community Health Center, please?
Yeah, thank you. So the Community Health Center has been established back in 1993, so we're coming on to our 25th year in the upcoming year. I've been in the employment, I think starting in 1998. I was a staff physician for the first couple of years, and ever since the early 2000s, I've been in a leadership position, initially as the medical director, and then more recently, as we've gotten bigger and expanded, now the chief medical officer. The Community Health Center is a federally qualified health center, which means it's charged by the federal government to take care of a population of people primarily here in central Manchester, but we have patients from the 9 surrounding communities, and we actually have several patients that travel sometimes more than an hour or two to access care, usually because those are patients that have a relationship with one of the providers and have enjoyed that relationship, so even though they've relocated, they continue to come back for medical care. In the center of Manchester, there are several at-risk populations. There are a variety of different challenges that those patients need to deal with. The 3 primary ones that the health center is able to help patients with is, number 1, those patients that don't have insurance. Fully 20% or 1 in 5 of our 16,000 patients do not have insurance, nor are they eligible for insurance. The next would be transportation. We are on the bus line, but frequently we utilize a variety of different private transportation services to allow patients to access care. And then lastly is the need for interpretation services.
I'll come to you on this point about interpretation. Meanwhile, do you want to share how many locations you have, or where is it possible to find you guys?
Sure. So our main location is at 145 Hollis Street. It's the old Dunn Furniture building, so we have the whole second floor. And then about 4 years ago, we expanded to a second site, which is on Tarrytown Road. It abuts the campus of Elliott Hospital. And then in the last 2 years, we've expanded to a third and a fourth site. The third site is Child Health Services, which is a wonderful organization that was established more than 30 years ago by a local private pediatrician, whose mission is very similar to ours, and in the last 2 years we've now combined forces. And then lastly, the West Side Neighborhood Health Center, which is located at Catholic Medical Center, which was initially run by Catholic Medical Center and then for a while Dartmouth Hitchcock. And then in the last year, we've taken over and provide the staffing and the support for that clinic.
Very interesting information here. Now, tell us, what's the unique of MCHC comparing to other places?
Sure. So as I said before, unlike a private physician who typically might take a few patients per month who don't have insurance and just provide free care, our mission is to take care of all the patients that walk through our doors. As recently as 4 years ago, 60% of our patients were eligible for insurance, which meant 40% had no coverage at all. And the federal government has a set of guidelines that allows us to provide discounted, but not free, but discounted care to a large portion of the population. Because of the Affordable Care Act, the number of patients that became eligible for some insurance product changed. So now that uninsured number, as I said, is now down to about 20%, or roughly about 3,500 of our 16,000 patients do not have any insurance. As a health center, we try and provide wraparound services. So under our roof, it's not just physicians, but it's physicians along with interpreters, social workers, therapists, educators in a variety of different topics, ranging from diabetes to hepatitis C to appropriate prenatal care. And then we have additional social support services, both care coordinators as well as case managers that will work one-on-one with clients to help get them the services that they need. And we will frequently have staff go out into the community to do outreach to those patients who are most at risk.
आदरणीय दर्शकबिन, यदि तपाईँ हेल्थ इन्सुरेन्स स्वास्थ्य बिमा नभएकै कारण तनावमा हुनुहुन्छ अथवा तपाईलाई कुनै न कुनै किसिमको स्वास्थ्य सम्बन्धी जानकारीहरू चाहिएको छ भने म्यानचेस्टर कम्युनिटी हेल्थ सेन्टरलाई तपाईले सम्पर्क गर्न सक्नुहुन्छ। 603-626-9500 मा सम्पर्क गर्नुभयो भने तपाईका हरेक प्रश्नको उत्तरहरू म्यानचेस्टर कम्युनिटी हेल्थ सेन्टरले पक्का पनि दिनेछ भन्ने म यहाँहरुलाई जानकारी गराउन चाहन्छु। Thank you so much for sharing. How do you feel about working for community and serving diverse community?
It's certainly one of the highlights of working at the health center. I've been at the community health center for my entire career. And much like my training program out in Colorado, which was predominantly a Hispanic population, I certainly enjoy the challenges of learning about different cultures and helping to provide care here in the States for patients who come from very diverse and different cultures. The health center has, much like Manchester, has dealt with several different waves of immigrants over the last 15, 20 years. When I first got to town, there were a great number of patients from Bosnia who were displaced because of the war, and followed by the Somali population in the early 2000s. But certainly over the last 5-6 years, far and away, the biggest population that we're seeing are patients from Bhutan and other Nepali-speaking people.
I'll come to you about Nepali-speaking people or about Bhutanese. Meanwhile, healthcare encounters can be stressful, compromising a patient's ability to fully encourage and understand. This is particularly challenging for patients who are limited English proficiency, also called LEP, and do not able to speak, read, write, and understand English at level. At this place, how would you address linguistic and cultural barrier faced by increasing number of LEP patients?
Yeah, it's a great question. It's tough enough to go to the doctor even if you're speaking the same language. Oftentimes you're not feeling well or you're having some sort of difficulty. That's what brought you to the doctor. So layer on top of that the fact that the physician isn't able to communicate with you, at least directly themselves. It certainly potentially makes for a greater challenge. I'm fortunate that I have a medical staff of 16 physicians and mid-level providers. More than half of them speak at least one language other than English, and a couple speak more than two. But I can't find enough physicians and providers that are language specific for each of the populations we serve. It is truly much more welcome. I've recently hired a Nepali-speaking nurse practitioner who works at our West Side office, which is very, in a perfect world, would be the ideal situation. But to meet the need of the supply of providers I have and the patients that we serve is we utilize, in over 55% of our visits, we utilize trained medical interpreters to facilitate that conversation.
Wow. So comparing to rest of the clinics, at least Manchester community have bilingual, bicultural provider with their interpreters.
Right.
What a wonderful. But meanwhile, how do you bridge the culture and the language gap if seen?
So in terms of the language gap, a trained interpreter's job is to exactly translate what's being said by the provider to the patient, and then exactly what the patient is saying back to the provider.
Vice versa.
We are fortunate in that the staff that we have provide me with cultural insights that when we utilize interpretive services either on the phone or there are online services, the fact that we have a live interpreter, oftentimes our staff member who are present, they can not only provide the translation, but they can also provide the unique perspective of someone who is bilingual and bicultural. So it's certainly we learn a great amount from individual cultures, from the interpreters that we employ.
So if anybody wants to come to Manchester Community Health Center, they don't have to suffer with language barrier or cultural competency because we have a trained medical interpreters at Manchester Community Health
We
Center.
are here to serve Manchester, and Manchester is increasingly a diverse community, and we try and meet the demand of the people who are coming through the door.
Can you share us one or two of the most remarkable moment you had while working with the patient?
So early on in my career, probably in the early 2000s, so I'm a family physician who also does obstetrical care. So those women that are healthy enough to have a vaginal birth, myself and the 4 other family practice physicians that I employ all attend over at Elliott Hospital. We deliver about 250 to 300 babies per year. So early on in the 2000s, I ended up having a delivery in which the patient spoke either Lithuanian or Estonian, and so she was on the phone for an entire 4-hour birth with a family member in her home country on speakerphone that was able to provide us with not only the translation but also the cultural support. So trying to deliver a baby with a patient in a different language presents unique challenges, but as in most deliveries, it's a joyous occasion with 2 healthy patients as the outcome. So that's certainly a highlight for me.
Wow. I get the fact that serving patients is the most rewarding part of your job. Perhaps most of the challenging barrier that you are faced with on your day-to-day work. Is there anything that you want to share?
Sure. The reason why myself and the other staff at the health center continue to work there is that we enjoy both the clinical challenge. For many of our patients, they've delayed access to care. So they might be presenting with medical problems that ideally would have been served by accessing a physician months or sometimes even years before. So we end up seeing a greater amount of pathology or disease in our patients. But also it's the sense of you don't do it for the thanks, but patients are certainly appreciative of the effort especially when you're dealing with patients that aren't speaking the same language. They actually seem to be more appreciative of the services that you provide than many of our English-speaking patients.
So you were talking about Bhutanese patient or Nepali-speaking patient in the clinic, and you also told that you have hired a Nepali-speaking nurse practitioners. In your opinion, what are the health-related challenges, particularly seen among Bhutanese or Nepali-speaking patients?
So, like many immigrant communities, oftentimes it's trying to adhere to your cultural norms while trying to live in a Western society that can be very challenging. The thing that many the Bhutanese population are challenged with is the disease of diabetes. Diabetes oftentimes is a disease associated with significant weight gain, and with that increased weight come not only diabetes but also high cholesterol and high blood pressure, all of which contribute to a higher risk for heart disease or heart attack, which continues to be the number one killer of people here in the States. So I find that a good number of my Bhutanese patients are challenged with diabetes, and oftentimes it's trying to figure out, because the food choices here versus from the communities where they come from oftentimes are more plentiful, but as a result there are a lot of bad choices that are available here as well. So the high carbohydrate, high fat, fast food diet, which is oftentimes associated with the States, is oftentimes one of the big challenges that anyone living here is faced with, but certainly someone who is used to a different food choices. So diabetes, definitely, and the challenge also is with patients that are new to the community, is trying to find a way, because oftentimes the West is associated with the perception of affluence because you have cars and you have access to transportation, but our community in general just doesn't exercise enough. It doesn't walk enough. And as a result, that's contributing as well to the increased weight and then the other problems that I mentioned.
So if we see in a broader way, is there anything we as a community could do differently to help our patient or the community?
And what I would say is not only true to the Bhutanese community, but also all the populations I serve. It's getting back to what I mentioned before. Exercise more, make better food choices. What's really interesting is that we haven't yet seen this in the Bhutanese community, but in our patients that are Hispanic, who are second generation here in the United States, their rates of diabetes as compared to their elders, who were the first generation immigrants, are sometimes 2, 3, 4 times higher. So it's the challenge of trying to pick up the positives of the lifestyle that's available here in the States, and more particularly here in Manchester, while trying to remember the appropriate things that lead to good health. More frequent exercise, less time watching TV or being on the computer, better food choices. It's okay to have a treat occasionally, but our culture sometimes is just interested in immediate gratification and making lots of bad food choices.
So is there any program at Manchester Community Health Center that could educate patients, or are you planning to bring any of the program to educate such kind of like diverse population patient?
So through the years, I'll speak back to diabetes. So we have a full-time diabetic educator who spends most of our times at our Hollis office, but does have some office hours over at the West Side office. I make mention of that because the West Side office has, of its 800 or 900 patients, probably a good 50% are Bhutanese. So that's where the greatest population of the patients from your community is that we serve. So having a diabetic educator to provide that information is certainly valuable. We have nutritionists who, again, can speak to patients that are challenged with either increased weight or high cholesterol or high blood pressure. We have sponsored periodically a program called Better Choices, which involves small groups of between 5 and 10 patients with a facilitator not only for a 30 or 40-minute visit, but for several weeks to try and understand the impact that the choices that an individual makes on their overall health. So there are always programs that are available for patients. The challenge is to try and engage patients and see if they can avail themselves of those programs.
Finally, do you want to give any advice or suggestions to young people who are trying to go in medical field?
It's a great profession. I have a daughter now who's 19, who's in college and has started to think about what she might want to do for her career. And just because her father is a physician, I've told her that it is a wonderful career, but ultimately you have to do something that you're passionate about. I like going to work each and every day because of what I do and where I do it. So I would hope for my daughter as well as other young people that they are lucky enough to find that thing that they are truly driven by. Medicine, and not just physicians, but be they physician assistants, nurse practitioners, physical therapists, nurses. There's a wonderful amount of opportunities available in the healthcare field, and it doesn't matter where you live, there's a great demand for those services. So I feel strongly that healthcare is a great field to guide young people to. But again, it has to be because they want to do it, not just because of the paycheck, but they like the encounters with people. They like the challenge to oftentimes figure out how to engage with a patient. And certainly the fact that it's portable and you can practice medicine in New Hampshire or Bhutan or Florida, it doesn't matter where you live, there's always going to be a demand for your services.
So if you come to this field, you'll never regret.
I don't think so, though. I think what's important is there are a fair number of physicians who get to their middle life that actually get burned out and they leave the medical field. Those physicians who are in private practice or they're trying to run a business, the way the health insurance industry works, it can be a challenge for an individual. I probably spend 10 to 15% of my time just filling out paperwork, not caring for patients, but doing paperwork. So regrettably, there are a great number of physicians that leave the practice of medicine. And again, that's why I say overwhelmingly, if you have a passion to help people, you can tolerate that degree of bureaucracy that exists right now.
Thank you so much for joining the show.
Oh, thank you.
आदरणीय दर्शकबिन, अहिले तपाईँ हेर्दै हुनुहुन्थ्यो कार्यक्रम खुला विचार। यो कार्यक्रम हरेक मङ्गलबार बेलुका 11 बजे र बुधबार बिहान 8:30 बजे म्यानचेस्टर पब्लिक टिभी च्यानल 23 मार्फत प्रसारण हुन्छ। यसको अलावा यहाँहरूले हामीलाई सामाजिक सञ्जाल जस्तै फेसबुक, ट्विटर अथवा तपाईले युट्युबमा गएर पनि खुला विचार लेख्नुभयो भने हरेक एपिसोड आउँछ, तपाईले क्लिक गरेर अवलोकन गर्न सक्नुहुन्छ। तपाईको फुर्सदको समयमा तपाईले www.manchesterpublictv च्यानल 23 मार्फत पनि हाम्रो कार्यक्रम खुला विचारलाई अवलोकन गर्न सक्नुहुन्छ। आज भने मसँग हुनुहुन्थ्यो म्यानचेस्टर कम्युनिटी हेल्थ सेन्टरका चीफ मेडिकल अफिसर डाक्टर ग्याभिन म्युर, जसले लामो समयदेखि डाइभर्स कम्युनिटीलाई सल्भ गर्दै आइराख्नु भएको छ। आज भने म कार्यक्रम प्रस्तुता सीएम निर्ला, मेरा अतिथि ग्याभिन म्युर र मेरो टेक्निसियन डेभिडका साथमा म प्रस्तुता सीएम निर्ला पनि बिदा हुन चाहन्छु। हवस् त, नमस्कार।